Hello everyone. Today your topic is chemotherapy of malaria and the topic is for second year pharmacology. And first of all we discuss about malaria. Malaria is caused by various species of plasmodia which are carried by the female Anopheles mosquito. Four species of plasmodium typically cause human malaria: Plasmodium falciparum, Plasmodium vivax, Plasmodium malaria, Plasmodium ovale. A fifth species, Plasmodium novesi, is primarily a pathogen of monkey but has recently been recognized to cause illness including severe disease in humans of Asia. Plasmodium falciparum is responsible for the majority of serious complication and death. So, sign and symptom. The sign and symptom of malaria typically begin 8 to 25 days of following infection, and the following sign and symptom are headache, fever, shivering, joint pain, vomiting, and hemolytic anemia. And here, according to the WHO, World Health Organization, if any of these symptoms are present, it is considered as complicated malaria. And the following symptoms are decreased consciousness, 2 or more convulsions, low BP less than 70 mmHg, circulatory shock, pulmonary edema, blood glucose less than 40 mg per dl, kidney failure or HB in urine or blood in urine. And the test for diagnosis are microscopy, rapid diagnostic antigen test, that is RDT, and PCR. Here we come on the classification of anti-malarial agent, which is based upon the mechanism of action. And the first classification is quinoline, artemisinin, antifolate, and antibacterial. And first we discuss about quinoline derivative. And quinoline derivative are subdivided into different categories or different drug: halofantrine, amdioquine, quinidine, mefloquine, primaquine, chloroquine, and lumefantrine. And these drugs have an activity against the erythrocytic stage of infection. Primaquine also kill intrahepatic form and germocyte. And the mode of action of quinoline derivatives. The mode of action you can see here: the human's hemoglobin, the host cell of the body. The parasite digests the host cell into for obtaining essential amino acid which parasite needed. And when the parasite digests the hemoglobin subdivided into the heme and amino acid. The amino acid are essential part for parasite that we taken out from that. And the heme, this process release large amount of heme which is toxic to the parasite. So for that, to protect itself, parasite ordinately polymerize the heme to a non-toxic hemozoin. So the parasite convert the heme into the hemozoin that is non-toxic to the parasite. But the quinoline derivative, for example chloroquine, inhibit the process of heme conversion to the hemozoin. Okay. And here you can see the adverse effect. Chloroquine is usually well tolerated. Nausea, vomiting, abdominal pain, headache, anorexia, and urticaria. Dosing after meal may reduce the effect. Rare reactions include hemolysis, impaired hearing, hypotension, agranulocytosis, retinopathy, and peripheral neuropathy. And the second drug is artemisinin. Artemisinin is a sesquiterpene lactone extracted from the herb called sweat wormwood. Most important of these analogues are artesunate, artemether, and dihydroartemisinin. And the mode of action of these drugs, antimalarial action involve the production of free radical within the plasmodium food vacuoles. The antimalarial action is acted on the food vacuole of the plasmodium. These analog bind to the that site. Which site? Analog, plasmodium food vacuole. This site, and damage the specific malarial protein. Okay, and the adverse effect of these drugs are neurotoxicity in animal, and rare toxicity include neutropenia and hemolysis in human. And the next drug is antifolate drugs. Antifolate drugs are, and the agent in this class are pyrimethamine and sulfodoxine. And the mode of action, this inhibited the DNA synthesis by inhibiting enzyme involved in the folate metabolism. And the next drug is antibiotics, antibiotic or antibacterial. A number of antibiotic in addition to folate antagonist and sulfonamide are moderate active antimalarial. And the mode of action, antibiotic that are bacterial protein synthesis inhibitor appear to act against malaria by inhibiting protein synthesis in the plasmodium like organelle. Okay, and the antibiotic used as antimalarial antimalarial drugs include doxycycline, clindamycin, azithromycin. And here is the treatment option. And in uncomplicated malaria, the in case of plasmodium vivax, the cases should be treated with chloroquine for 3 days and primaquine for 14 days. Primaquine is used to prevent relapse but contraindicated in the pregnant women. And in case of plasmodium falciparum, cases should be treated with ACT accompanied by single dose primaquine on day 2. And the options are in combination therapy are artesunate plus amidoquine, artesunate plus asp, and artesunate plus miflaquine. And the pregnant women with uncomplicated plasmodium falciparum should be treated as follow. In first trimester, quinine is prescribed, and in second and third trimester, ACT is prescribed. The primaquine is contraindicated in pregnant women. All mixed infections should be treated with ACT and primaquine therapy for 14 days. And the severe malaria, administration of parenteral artemisinin therapy. After that, full course of oral ACT for 3 days and combination of quinine plus doxycycline. And this is your antimalarial drugs or chemotherapy of malaria. And I will give you some homework over there. You can tell me in comment section that in this topic what is ACT, okay, what is SP, okay, and what is urticaria, okay, and thank you.